fundamental to value generation. So it's not widely understood what the input or what the benefits of doing imaging are. So raising awareness is a big part of what we do or should be doing. We need to raise awareness of ways that value can be harnessed and enhanced by not just those who utilize, but also those who deliver radiology services. And value is something that doesn't just fall out of trees or that it's hidden somewhere and we just need to go and find it. Value is something that needs to be created. Fortunately for all of us in this room, there is no meaningful value creation without research. However, the research strategy should be aligned with this value creation cycle. And this is where the potential opportunities lie for radiomics and the research that we do, focusing on areas where value can be generated and is needed. Just to name a few examples: screening, early detection, diagnosis, treatment delivery and monitoring, estimating prognosis, and education, using radiomics to guide the ground truth and what radiologists and imagers in general can do to enhance the interpretation of the imaging studies. Why would we do all this? Why should we invest in this concept? We want to be recognized as a key component of healthcare with impact on patient outcomes. We want to be considered a vital element of value-based healthcare. And perhaps most importantly of it all, we want to be part of any calculation of value-related metrics and any resourcing decisions that are based on such calculations. How do we achieve this? Well, the RSNA and the ECR have been working hard on this. This is one of the papers that came out from Adrian Brady of the ECR in conjunction with multiple other societies that kind of lay out a plan for all of us in the field to try and follow. It's relatively simple. We must engage patients. We must engage referrers directly and often as the only way to understand their needs and understand that these needs vary over time, hence why we need to engage them recurrently. We need to ensure that all of our imaging groups work cohesively, that we work operating as teams that ensure and maximize the likelihood of us achieving enterprise-wide and community-wide goals that are set up. We need to structure our departments to our work plans in our departments to meet the needs. And this includes examples like setting out dedicated time for multidisciplinary collaboration. We need to utilize our existing resources, and we need to create new resources and tools that optimize information exchange using the appropriate IT infrastructure. So just to conclude, value-based healthcare, whether we like it or support it or not, at least as a concept, is here to stay. It's not going anywhere, no matter if we practice in the US, in Europe, or anywhere around the world. This is here and will underpin future planning and resource allocation in all aspects of medical care. Models of defining value and exactly what formulas will be used to calculate it remain in evolution, and researchers and clinicians must take value-based healthcare into account when planning, developing, and delivering their services. Thank you for your attention.
Thank you, Dr. Vargas. Appreciate it. Do we have any questions? Okay. Oh, sorry. I thought there was one back. All right. Our next speaker is Amber Simbert.